Symptoms of high cholesterol and serious health problems. The symptoms of high cholesterol pose many health dangers, and the mortality from these health problems is the most serious problem in the world. Cholesterol is a waxy, fat-like substance that your liver produces. It's vital for the formation of cell membranes, vitamin D, and certain hormones. Cholesterol doesn't dissolve in water, so it can't travel through the body by itself. Particles known as lipoproteins help transport cholesterol through the bloodstream. There are two major forms of lipoproteins. Low-density lipoproteins, LDL, or bad cholesterol, can build up in the arteries and lead to serious health problems, like heart attack or stroke. High-density lipoproteins, HDL, or good cholesterol, help return the LDL cholesterol to the liver for elimination. Meanwhile, eating too many foods that contain high amounts of fat increases the level of LDL cholesterol in your blood. This is known as high cholesterol, also called hypercholesterolemia or hyperlipidemia. When levels of LDL cholesterol are too high, or levels of HDL cholesterol are too low, fatty deposits build up in your blood vessels. Then, these deposits will make it difficult for enough blood to flow through your arteries. This could cause problems throughout your body, particularly in your heart and brain, or it could be fatal. Symptoms of high cholesterol. High cholesterol typically doesn't cause any symptoms. In most cases it only causes emergency events. For instance, a heart attack or stroke can result from the damage caused by high cholesterol. These events typically don't occur until high cholesterol leads to the formation of plaque in your arteries. Plaque can narrow arteries so less blood can pass through. Moreover, the formation of plaque changes the makeup of your arterial lining. This could lead to serious complications. Genetic conditions can cause high cholesterol. There is a condition passed through genes that causes high cholesterol called familial hypercholesterolemia. People with this condition have cholesterol levels of 300 mg per deciliter or higher. They may experience xanthoma, which can appear as a yellow patch above the skin, or a lump underneath the skin. Coronary artery, heart disease, can be caused by symptoms of high cholesterol. Symptoms of heart disease may be different for men and women. However, heart disease remains the #1 killer of both sexes in the United States. Specifically, the most common symptoms include angina, chest pain, nausea, extreme fatigue, shortness of breath, pain in the neck, jaw, upper abdomen, or back, numbness or coldness in your extremities. Stroke can be caused by symptoms of high cholesterol. The buildup of plaque caused by high cholesterol. They can put you at serious risk of having the blood supply to an important part of your brain reduced or cut off. This is what happens when a stroke occurs. A stroke is a medical emergency. It's important to act fast and seek medical treatment when you or anyone you know experiences the symptoms of a stroke. Specifically, these symptoms include sudden dizziness, sudden loss of balance and coordination, facial asymmetry, drooping eyelid and mouth on just one side, inability to move, particularly affecting just one side of the body, confusion, slurring words, sudden severe headache, numbness in the face, arm, or leg, especially on one side of the body, blurred vision, blackened vision, or double vision. Heart attack can be caused by symptoms of high cholesterol. The arteries that supply the heart with blood can slowly narrow due to the buildup of plaque. This process, called atherosclerosis, happens slowly over time and has no symptoms. Eventually, a piece of the plaque can break off. When this happens, a blood clot forms around the plaque. It can block blood flow to the heart muscle and deprive it of oxygen and nutrients. This deprivation is called ischemia. When the heart becomes damaged, or part of the heart begins to die due to the lack of oxygen, it's a heart attack. The medical term for a heart attack is myocardial infarction. According to the American Heart Association, someone in the United States has a heart attack roughly every 34 seconds. Specifically, signs of a heart attack include difficulty breathing, tightness, squeezing, fullness, pain, or aching in the chest or arms, anxiety or a feeling of impending doom, dizziness, nausea, indigestion, or heartburn, excessive fatigue. A heart attack is a medical emergency. Damage to the heart could be irreversible, or even fatal, when treatment doesn't begin in the first several hours after a heart attack. It's important to act fast and seek medical treatment if you or anyone you know experiences the symptoms of a heart attack. Peripheral arterial disease can be caused by symptoms of high cholesterol. Peripheral artery disease, PAD, can occur when plaque builds up in the walls of the arteries. This will block the flow of blood in the arteries that supply blood to the kidneys, arms, stomach, legs, and feet. Symptoms of early peripheral artery disease, PAD, such as cramping, achiness, fatigue, discomfort in the legs and feet. Pain in the legs during activity or exercise, called intermittent claudication. As peripheral artery disease progresses, symptoms occur more frequently and even occur when you are at rest. Later symptoms that may occur because of reduced blood flow include thinning, paleness, or shininess on the skin of the legs and feet. Tissue death caused by lack of blood supply, called gangrene. Ulcers on the legs and feet that don't heal or heal very slowly. Leg pain that doesn't go away when at rest, leg cramps. Thick toenails. Burning in your toes. Toes that turn blue. Reduced hair growth on the legs. Decrease in the temperature of your lower leg or foot, compared to the other leg. So, people with peripheral artery disease, PAD, have a higher risk of having a heart attack, stroke, or limb amputations. Diagnosis of high cholesterol. High cholesterol is very easy to diagnose with a blood test. It is a lipid panel. Your doctor will take a sample of blood and send it to a laboratory for analysis. Also, your doctor will ask that you do not eat or drink anything for at least 12 hours prior to the test. A lipid panel measures your total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. The Centers for Disease Control and Prevention, CDC, says these are the desirable levels. LDL cholesterol, less than 100 mg per deciliter. HDL cholesterol, 60 mg per deciliter or higher. Triglycerides, less than 150 mg per deciliter. Your total cholesterol is generally considered borderline high if it's between 200 and 239 mg per deciliter. It's considered high if it's above 240 mg per deciliter. Your LDL cholesterol is generally considered borderline high if it's between 130 and 159 mg per deciliter. It's considered high if it's above 160 mg per deciliter. Moreover, your HDL cholesterol is generally considered poor if it's below 40 mg per deciliter. How to monitor your cholesterol? A blood test is the only way to know if your cholesterol is too high. This means having a total blood cholesterol level above 240 mg per deciliter, milligram per deciliter. Moreover, ask your doctor to give you a cholesterol test after you turn 20 years old. Then get your cholesterol rechecked every 4 to 6 years. Meanwhile, your doctor may also suggest you have your cholesterol checked more frequently if you have a family history of high cholesterol. Or if you demonstrate the following risk factors: smoking, are overweight, have high blood pressure. The American Heart Association recommends having your cholesterol levels checked every 4 to 6 years. You may need to have your cholesterol checked more often if you are at an increased risk of high cholesterol. Because high cholesterol doesn't cause symptoms in the early stages, it's important to make good lifestyle choices. Eat a healthy diet, maintain an exercise routine, and regularly monitor your cholesterol levels by getting them checked at the doctor's office. Note: understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: The One Food Cholesterol Cure, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you, I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.